over here also. And again, I'm showing you this in two dimensions now, so it's basically in 3 dimensions. And what this means is that this patient has had a heart attack, and this muscle has essentially scarred or has died. So the function of this heart is not normal, and we can evaluate this in a moving picture. And the moving picture would essentially show that this wall right here is not moving, which affects the pumping of blood out of the heart. We're able, again, to do 3-dimensional imaging, and essentially this is what we can obtain with a cardiac CT scanner. And essentially, I'm basically showing you the same image that a catheter angiogram would. This is actually obtained with a CT scanner, not a catheter angiogram. And it just shows that we can obtain 3-dimensional images almost as good as we can with catheter angiogram. So essentially the future is now. These are just other means of seeing the coronary arteries, where we can just stretch out the vessels, something that you can't really do with a catheter angiogram. We can stretch out the vessels and see the vessel in its entirety. You can see little specks of calcium here and there. This patient doesn't have any significant severe disease, but at least we can tell the patient, you already have some disease. It's best to start taking care of yourself now. Let's take some medications to prevent increased cholesterol, etc. And this is where we want to catch the patient. We want to be able to catch the patient at an early stage where we can prevent any kind of severe outcome. Again, this is just showing you the left anterior descending coronary artery, again showing you already some mixed plaque, calcified and fatty. And typically when we see this, we'll describe the lumen or the stenosis and the location of these plaques. And typically it's enough for the patient to actually take action. Other things we can evaluate are patients who already have heart surgery. They have bypass surgery. And in this case, for example, we have a 3D image, and this is actually a CT image. It's not a coronary catheter angiogram. This is actually a CT image. It looks just like a catheter angiogram. And this is what we call the LIMA, or left internal mammary artery bypass, where the artery is actually attached to the LAD because the proximal aspect of the native artery was diseased, be it severe stenosis or actually even occlusion. And they bypass that proximal aspect in order to feed the more distal arteries. So we can actually do 3D reconstructions and actually thin slice imaging of the graft, showing you perfect union with the native vessel, showing that there really is no significant stenosis. Again, this is showing the bypass of the LIMA coming all the way down to the anastomosis, showing that there's contrast seen past that union. And these are all little surgical clips seen along the vessel here. And this is a MIP projection. Now, what I wanted to talk to you about very quickly here is which are the indications for this procedure. Should we do screening on everybody on this? Well, no, we shouldn't. Number one is because the radiation that entails this procedure. Unfortunately, it is a CT scanner and it does include radiation. So typically, there's got to be some kind of risk to the patient for us to perform this procedure. The amount of radiation that we give in this study pretty much equals the same amount of radiation that you would receive with a regular catheter angiogram. So typically, we take that into consideration and we weigh the risks versus benefits of this procedure. So we typically don't like to do this on very young patients, although sometimes it is actually a very good study to do on young patients. Like I showed you before, patients who might have coronary anomalies, or patients who have maybe a family history where maybe in their 30s, maybe they had a family member in their 30s or 40s who died because of the heart attack, because of basically genetics. People who are worried about getting a heart attack at an early age, this might be an excellent study to perform. So actually the best way or a reason to perform the study is actually on people who are at low risk of coronary artery disease, meaning people who the suspicion of having coronary artery disease is low.